This video is based on understanding labyrinthitis, a plain English information sheet for patients, published by Australian Dizziness Clinics, available at australiandizzinessclinics.com.
Welcome to Understanding Labyrinthitis, information for patients. If you're tuning into this right now, chances are that you, or maybe someone you love sitting right next to you, are going through some pretty frightening symptoms. You know, that sudden, really intense dizziness, feeling totally off balance, maybe your hearing has suddenly changed. It's a lot. It can be incredibly overwhelming. So take a deep breath with me. You are seeing, we understand exactly what you're going through, and we're going to break this all down together so you know exactly what is happening in your body.
You're probably asking yourself right now, why on earth is the room spinning, and why does my hearing sound so muffled? Literally 1 minute you were totally fine, and the next, bam, hit with this terrifying, severe vertigo. The room is spinning like a merry-go-round, you're likely feeling super nauseous, and on top of all that, your hearing just dropped or you've got this loud ringing in your ear. I want to validate that right out of the gate. It is severe, and it is genuinely scary. But here's the really reassuring news. Every single one of these confusing symptoms, they have one clear, totally understandable medical explanation.
What you are experiencing is medically known as labyrinthitis. Essentially, it's a sudden inflammatory condition happening deep inside your inner ear. The real hallmark here, the thing that actually makes labyrinthitis unique, is that both the balance centers and the hearing centers of your ear are being affected at the exact same time. They share this really tiny, delicate space. And right now, well, that whole space is dealing with a massive wave of inflammation.
Let's picture that anatomy for a second. Deep inside your ear, you've got two distinct tools sharing the same fluid-filled system. On one side, there's the cochlea. That's the little snail-shaped part that handles your hearing. On the other side, you've got the balance canals, and they're the ones detecting your head movements to keep you steady. Because they're physically connected, when an inflammatory bug gets in there, both of these parts essentially catch fire with inflammation at exactly the same time. So your hearing gets muffled because the cochlea is inflamed, and the room spins because those balance canals are sending panicked, totally incorrect signals to your brain.
Now you might be wondering, how did I even get this? Well, for adults, the most common culprit is actually just a simple viral infection. Sometimes this kicks in right after you've fought off a common cold, the flu, or maybe COVID-19. Or sometimes it's just a dormant virus, like the kind that causes cold sores, that simply decided to wake up. But here is something absolutely crucial for you and your family to know. While a virus might have triggered this, you are not contagious right now. You literally cannot pass this dizzy spell on to anyone caring for you. It's strictly an internal reaction happening deep within your own ear.
Okay, moving into section 2, the treatment pathway, fixing the inflammation and restoring your balance.
Let's talk about the action plan, the medical roadmap your doctors will likely use. Step 1 usually involves taking high-dose anti-inflammatory tablets, specifically corticosteroids. Step 2 is honestly a bit counterintuitive, but so important. You have to stop taking those dizziness suppressants after the first few days. Sure, medicines that suppress nausea are totally fine for the first 48 to 72 hours when the spinning is at its absolute worst. But if you keep relying on them for weeks, they actually block your brain from learning how to heal. And that leads us right to step 3, vestibular rehabilitation, which is a set of specific movement exercises you'll get from a physiotherapist.
Regarding those anti-inflammatory tablets, time is really of the essence here. Corticosteroids significantly improve your hearing recovery, but only when they're started early. The clinical data on this is super clear. Starting these tablets within the first 72 hours, or at least within the first couple of weeks, gives your hearing the absolute best chance of bouncing back. The medication rapidly brings down that swelling inside the delicate cochlea, so if your doctor prescribed these, taking them exactly as directed is your #1 priority to protect your hearing. Down the line, a huge part of getting your life back comes from those vestibular rehab exercises. And I'll be honest, when you start doing these head and eye movements, you're probably going to feel dizzy, exhausted, and maybe a little sick. Naturally, you'll think, oh no, I'm making it worse. I need to go lie down in a dark room. But here's the crazy part. Staying perfectly still actually slows your recovery down. Feeling that residual dizziness while you exercise, that's actually a good sign. It literally means your brain is getting those messy signals from your ear and is actively working hard to adapt, rewire, and heal.
It's all thanks to something called neuroplasticity. Your brain is already working to fix this. Even if that balance nerve stays a bit damaged, your brain is just a master compensator. It quickly figures out how to ignore the faulty signals from the inflamed ear, and instead, it relearns how to balance by relying heavily on the perfect signals from your healthy opposite ear, the visual cues from your eyes, and literally the feeling of the ground under your feet. It essentially rewires its own software to get you walking straight again. How amazing is that? Now, even though labyrinthitis is incredibly scary, remember, it is an ear problem, not a brain problem. That being said, you absolutely must be aware of certain red flag warning signs. If you experience double vision, any drooping on one side of your face, weakness or clumsiness in your arms or legs, or if your symptoms just suddenly get drastically worse, you need to seek emergency medical help right away. Those are not typical labyrinthitis symptoms. They can be signs of something much more serious, like a stroke, and you've got to get that checked out immediately.
Let's lay out a clear timeline so you know exactly what the road ahead looks like. Days 1 and 2? Those are the hardest. That's when the severe spinning and nausea hit their absolute peak. Then, over weeks 1 through 6, as you do your exercises and get off the suppressants, your balance will steadily come back as your brain adapts. And looking at the months ahead, your hearing and overall daily function will just continue to recover. The biggest takeaway here is hope. With early treatment and dedicated movement, the vast majority of people recover remarkably well from this.
Your brain's ability to heal and rewire itself is truly remarkable. So as you move forward, ask yourself, how can you best support your body's natural drive to find its balance again? For the patient leaflet and our full patient series, visit AustralianDizzinessClinics.com. Please subscribe to support the channel.